a couple of hours prior to ending my life, I walk into TAIBU. And ever since then, my life has changed tremendously.
Social prescribing is filling the gap between clinical and non-clinical needs. So we advocate for people to navigate the healthcare system, whether it's referring them to a doctor or referring them to a program. So we kind of help bridge that gap. And so when they come and experience social prescribing, their quality of life improves because they're getting help in all aspects.
We have two different social prescribers, one that's focused on the Black community and one that's more general to the rest of the community.
That social prescribing navigator is able to actually call, assess, and help the client access the support or the service that the person needs. They're able to follow up with that client and actually say, did you attend the program, or were you able to find whatever support relevant or beneficial? And so having that person being able to do the intentional assessment and then monitor and see how that affected the patient, I feel that that has been the most impactful thing and why we really wanted to have a social prescribing program at TAIBU.
The programs particularly that I'm a part of or I support or lead are African-centered or culturally sensitive. So there's different African principles that are embedded in our intake process. So right from the beginning, so systematically it's embedded, which creates a whole different level of safety and inclusion.
Walking into TAIBU, the people around you is very pleasant. You can discuss your feeling or whatever is going on with the person beside you, and they do the same thing. You can give them advice, they can give you advice.
I get involved with exercise, yoga, and dancing.
The social aspect is very good. It's good for you mentally, you know. I'm 80 years old, going on 81. And, you know, one day at a time. I love life and I like to be out and about.
We have a lot of patients who are medically complex, but they're also socially complex. And so to expect a clinical provider to address both medical and social complexities can also be draining for a provider.
To know that I have other people that I can talk to internally and be able to refer clients to better meet their needs really contributes to job satisfaction, and knowing that I'm not alone and that I don't have to do everything, especially things that I'm not trained or qualified to do. Social prescribing is a way to help to support and take the burden off of healthcare providers. So it could be a huge cost-saving and time-saving initiative. We're only scratching the surface with a short-term project, but what I know can make a huge difference, and we could see a lot more benefits in 2, 5, 10 years from now.
What I love and what I've heard even my colleagues and the community love about Black-focused social prescribing in particular is we look at the different African principles and the African-centered way of working together.
I love the feedback that I've gotten from clients in terms of all the people that have worked there. Just being a part of that team, like, it makes me feel really good.
Everyone who joined in the program is quite happy with what's going on at TAIBU. They've done a remarkable job.
It's kind of refreshing. I like it.
I love this place here. What TAIBU has given me, I don't think there is anywhere else I could have got this.